Schedule today. So I wanted to thank you all for coming out to our event. Just so y'all know, any kind of movement, walking around, sitting, fidgeting, eating, drinking, camera on, off, whatever is totally welcome. Today we have Cassie, Quinn, Brandon, Eddy, and Deanna, Britton here presenting medical speech pathology, and it's going to be followed by a Q&A. If you have any questions during the presentation, please feel free to enter them in the chat or raise your hand. So yeah, without further ado, welcome our panelists.
Sounds great. Thank you everybody for being here. I'm just going to share my screen. And I'll push present. Just want to make sure everybody can see that okay. Perfect. I'm seeing some thumbs up, so that's good news. Thank you all for being here again. My name is Brandon Eddy. I'm an assistant clinical professor in speech and hearing sciences. We are going to be here today talking about medical speech language pathology. And certainly our medical concentration will be a component of the conversation today. We're excited to talk to you about this. We're equally excited for your questions, which we want to learn more from you. So what are your questions as we go? Please feel welcome to send those in the chat, and we will definitely address those as we can. First, a bit about us. I'm actually going to begin by passing it off to Dr. Britton to introduce herself.
Hello, everybody. I'm Deanna Britton. I'm an assistant professor in the department. I also have a joint appointment at Oregon Health and Science University. And I'm super happy to be here this morning to talk to you all about medical speech language pathology. Prior to returning to school to get a PhD, I actually worked for more than 20 years as a medical speech language pathologist across the continuum in the area of working with adults. And with that, I guess I will pass it off to Cassie Quinn.
Good morning, everybody. So I'm Cassie Quinn. I'm a clinical professor here in the Speech and Hearing Sciences Department. This is my 9th year here, and I have been a practicing medical speech language pathologist for 20 years now, and with a primary focus on adults, but have treated across the continuum. And I also have a board certification in swallowing and swallowing disorders, so that tends to be my, my primary area of focus. And I am thrilled that you are all here.
And lastly, a bit about me. As I mentioned before, I'm an assistant clinical professor. My name again, Brandon Eddy. I've had many of you in my classes, so it's great to see you all again. My primary professional experience has been in pediatric outpatient hospital type settings, although I've done some inpatient pediatric work as well. My primary areas of practice are augmentative and alternative communication, as well as cleft and craniofacial care, although we've certainly covered feeding and swallowing, as well as a number of other areas too. So I'm happy to speak to those as we go. Before we begin, we're going to ask for your participation, because this will give us a good sense about some of your foundational understanding of what is medical speech language pathology. So we've got a set of 3 Jamboards I'm going to share with you. I'm going to escape out of, there we go. That worked surprisingly well. I'll paste this in the chat so everybody has access to our Jamboards. If you can go to the chat and select the Jamboard. Oops, I pushed stop share. It is going to open up a set of Jamboards. We have 3 of these total, and I'll show you how to navigate in case you haven't used Jamboards before. At the top of your screen, you'll see this 1-3 icon, 1/3, right top middle. If you push the arrow, it's going to navigate to our 2nd Jamboard and eventually to our 3rd. If everybody can begin just by being on the 1st Jamboard for me, what we're going to begin with is having you participate by answering, what do you think of when you picture a medical speech language pathologist? Maybe it's actually a physical picture. There we go, scrubs. I see that appearing on here. That is certainly sometimes a part of what we wear in medical speech pathology. So in case you haven't used Jamboards, on the left side of your screen, right below the cursor icon is this sticky note. When you press that, it's going to pull up a tab in the middle. You can type whatever you want in here and then push save, and it's going to save to the screen. If you'd prefer to use an image, that's actually right below the sticky note icon, and you can Google all sorts of images on there. So yeah, just again, as you go through, we'd appreciate it if you can add your thoughts onto this in terms of what you feel, what you picture when you think of medical speech pathology. All right, so I'm seeing hospitals, scrubs. I see a bit about the types of practice, including dysphagia, swallowing, maybe procedures we're doing like modified barium swallow studies. I love this interdisciplinary focus here of working with PTs, OTs, and other folks. We have settings like hospitals, counseling. That's a great one. We definitely do a lot of that too. SNFs, yes, settings like a skilled nursing facility, VA, places like that. Great. This is a really good start. I can tell we're covering quite a range of areas, treatment areas, including settings too, which we'll get into. Let's go ahead and go to that second Jamboard. What settings do medical speech language pathologists work in? So maybe based on your observation experiences or your own professional experiences, what types of settings do medical SLPs work in? Great, seeing inpatient, hospitals, acute care. And for those of you trying to find that second Jamboard, just remember again, it's at the top of your screen. You just push the arrow to get to 2 of 3. Awesome. Pediatric hospitals, home health, outpatient clinics, NICU. Wonderful. All right, good. Seems like we have a pretty nice baseline understanding of types of settings that medical SLPs practice in. Hopefully today we'll expand that a bit to help understand that medical SLPs cover quite a range, including when we think of outpatient clinics, there's a large set of types of outpatient care that we can get into. Good, this is great. Let's go ahead and research. Awesome. Thank you for adding that too. Yes, we often have a research component in some of our jobs. Let's go to page 3, if we can look at that. What treatment areas do medical SLPs cover, or specifically, what do we treat when we are working as a medical SLP? Excellent. Aphasia, stroke, dysphagia, apraxia, dysarthria, voice, speech sound disorders. Hopefully from someone who's taken my speech sound disorders class, we know that. Good, this is a great start too. And again, this is on page 3 in case anybody else is trying to add to this. TBI rehab, articulation disorders, great. Good, this one's actually sometimes surprising to a lot of students that even in the medical world of speech pathology, we still treat speech sound disorders as depending on the setting you're in and the type of practice you have. Executive functioning, excellent. Perfect. All right, everybody. Well, thank you so much for your participation here. It seems like we have a great foundation. Again, hopefully we'll keep expanding upon that. I'm going to head back to our presentation and bring us into our next slide, which Dr. Britton will be discussing.
Okay, thanks everybody. You all had a lot of really good responses on the Jamboard, and a lot of it, I really didn't see anything on the Jamboard that really wasn't right in line with a lot of what we do cover in medical speech language pathology practices. I'm going to begin by mentioning a few of the aspects that are assessed and treated by medical SLPs. So that would include the area of dysphagia, meaning swallowing disorders. When I was working within a hospital, swallowing disorders comprised probably the biggest part of my caseload. That's not necessarily the case, however, in all areas of the continuum. It really depends, but it is a major component of what we cover. In addition, motor speech disorders, and in the pediatric, correct me if I'm wrong, Brandon, pediatric populations, it could also be speech sound disorders. Motor speech disorders would include some of the various types of dysarthria, but also apraxia of speech and childhood apraxia of speech. And then, of course, voice disorders. It's fairly common that speech language pathologists will work side by side with otolaryngology physicians. Those are basically ear, nose, throat physicians to assess and treat voice disorders. Craniofacial impairments, that's an area of expertise with Brandon, and language processing disorders. So it could be anything ranging from the various types of aphasia on down to some of the disruptions to language processing that can occur within the context of general cognitive communication impairments. And then, of course, there's quite a lot that falls under the rubric of what we call cognitive communication. Under cognitive communication, we might include all aspects of language processing, but also things like memory, attention, and, as mentioned on the Jamboard, executive function skills. So we do work with a wide variety of individuals who have acquired developmental and neurodegenerative conditions in both adult and pediatric populations. This also often includes overlap with other medical interventions, such as having a tracheostomy. That's basically a tube that is inserted under the larynx to allow for airflow in and out of the body. And there's a lot of details related to tracheostomy to be aware of, and various forms of mechanical ventilation, both invasive and non-invasive forms. And then last but certainly not least, AAC, which is augmentative and alternative communication. All right, next slide. There's a continuum of care that we often refer to. So we have worked to try to simplify, but also depict this in the image that you see here. So medical speech language pathologists may be working across multiple areas of the continuum or primarily in one area of the continuum. It really is variable depending on where you are working, where you're hired, and or whether you are in private practice, for example. So if I just relate this to my own experience working with adults, I have actually worked across most of these areas of the continuum. I have, my initial practice began in inpatient rehab facilities. And so I've worked at a private inpatient rehab facility that was Craig Hospital in Colorado. I've also worked in major hospital inpatient rehab facilities at, for example, at Harborview Medical Center in Seattle and at the Puget Sound VA. And within the hospital settings, I have also worked both outpatient rehabilitation settings and in acute care. Acute care is also pretty broad because acute care could include visits to the ED, the emergency department, emergency room. Could also often does include working in the medical ICUs. Well, there's a variety of different types of ICUs. There's like a neurological ICU, medical ICU, cardio ICU, neonatal ICU, all sorts of different ICUs that are out there. And then there's also acute rehab, someone who maybe has transferred from the intensive care unit or maybe was admitted directly to an acute care floor that's not an intensive care unit. We work with those folks as well. Oftentimes in that case, we are assessing limited intervention, but assessing to determine what type of intervention is recommended and setting up plans for that. And then, of course, there's a lot of different medical speech language pathology scenarios that occur in the community as well. Including things like home health practice, private practices, there are outpatient clinics, hospital outpatient clinics. And Brandon, what have I missed in the pediatric world?
I think that's pretty encompassing. There's similar terminology. I don't know that a lot of sites maybe classify themselves as inpatient rehab for on the pediatric side as much, but the same practices that we consider inpatient rehab for adults are present for pediatrics as well.
Mhm. And then I think I neglected to mention the skilled nursing facility settings as well, which we have quite a lot of speech pathology involvement there. Cassie, have I missed anything that you can think of?
Nope, I think you covered it.
All right, so we're going to move on. And actually, at this point, I think I'm turning things over to Cassie.
Perfect, thank you. So within those settings, in thinking about what kinds of disorders that we treat, this is a really nice graph breakdown to kind of show you areas of intervention and primarily what focuses we have in the settings. So as we can see on the left for adults, swallowing at 40% is our primary focus, and that is going to be higher within an inpatient acute care setting versus as you continue down the spectrum, you may move more into the aphasia, cognitive, dementia areas. And then on the right side, we talk about pediatric areas of intervention. And as Brandon was alluding to earlier, speech sound disorders are pretty high up there, which again, we don't typically think about when we think about medical speech pathology. We maybe sometimes think about feeding and swallowing, which is actually, fourth out of these four that we highlighted. So we've got other high focus is autism, language and literacy, and then that's swallowing and feeding. On the Jamboard, somebody mentioned interdisciplinary practice, which is awesome. So who do we work with? And I know that, at the top of our list is usually PTOT, but we do have a myriad of other professions that we do work with. And this list is comprehensive for primary people that we tend to work with, but honestly, the list could go on and on and on. There isn't really a specialty out there we probably don't work with. So, we've got our physical therapy and occupational therapy. We work a lot with respiratory therapy when we are working on swallowing or trach and vent, looking at passing mirror valves for folks who have tracheostomy. So they're very instrumental in that. We work very closely with dietitians when we are working to, wean somebody from a feeding tube to make sure that they're meeting their dietary needs. Or if they happen to be a wound person, we have to make sure that they're getting the right dietary nutrients for healing. So we work really closely with our dietitians, social work as well. Social work tends to be more in the actual hospital setting. I think we can all attest to feeling like we need more social work intervention in other areas in regards to rehab and outpatient and clinics and private practice. Social work is a really huge component for our patients, and we feel like we need more access to them. Psychology, we do wear a counseling hat, but there is a time and a place to decide to refer out and to have psychology actually take over with some of those needs from whether they're dealing with loss, if they've had a stroke, or if it's cancer and they've lost part of their anatomy in their oral cavity or whatnot. There's a lot that goes along with that with regard to feeling, loss and frustration and kind of going through that grieving process. So psychology is going to be really important. We obviously work a lot with nursing. I don't actually see a patient until I've touched bases with a nurse to see where they're at. So that's a daily practice. We have our physicians who, without them, we can't do anything because we do need them to sign off on our orders. Radiology for our modified barium swallow studies, spiritual care and palliative care. And these last two, I actually sat on a team with spiritual and palliative care for appropriate PEG tube placement at one of the hospitals I worked with. And I found spiritual and palliative care folks to be just really instrumental in looking at the patient holistically and making sure that we're making the right decisions for quality of life. So they seem to be people that maybe we don't think about as much, but for my experiences, they were very instrumental in a holistic approach to treatment. So what can we do in a medical setting? What can our role be? And again, we saw some of these on the Jamboard, so great job there. Obviously, the initial thing that we do is we're clinicians, and that can be at a various level, depending on where you're working. So that's our primary role. But then that over time could turn into being like a team leader. So you might coordinate efforts of several professionals, coordinating the PT/OT speech team, and we're still primarily doing clinical services. And then that can turn into administrative positions like directors of rehab, who actually coordinate activities, they coordinate the insurance portion, they coordinate the teams to determine how much treatment each discipline should be working on with a patient. And so that tends to start steering away from a clinical role. However, in skilled nursing facilities in particular, a lot of the time directors of rehab are doing dual roles. They're being directors, but they're also still seeing clients. And then researchers, both Brandon and Dr. Britton, they do research in their jobs. And so this definitely can be a component. And if you're at a hospital like an OHSU or VA, these can tend to be very big parts of your job.
I'm going to talk a little bit about income, since it's often a question that students have and is not really addressed in a lot of classes. So this actually comes from the 2019 healthcare survey that was administered by ASHA. This survey is sent out to practicing speech-language pathologists, who then respond about a variety of questions, one of which has to do with their income. Now, as we look across this, I want to provide some context. This is national averages. It's important to realize we are on the West Coast. As being on the West Coast, we often get paid more than those in Midwest and other areas too. So that's important to be aware of. It also does not readily separate pediatric care from adult care. And as you'll see on other surveys in the healthcare survey, adult care tends to make slightly higher income than pediatric care. So just being aware of those, it's all kind of meshed together in here. What you'll see here following horizontally is types of facilities. So we have VA, long-term care facilities, home health, outpatient clinics, pediatric hospitals, rehab hospitals, and then SNFs, or skilled nursing facility. I'm going to direct your attention to the average, which you'll see on the row labeled mean. And what you'll see on average, if we sum up everybody's income across these settings, roughly around almost 82,000 tends to be what SLPs are making. Now, again, this is not separating out years of experience. There's a lot of information missing from this table. So just appreciating on average, generally medical SLPs are making on the low end of approximately 77,000, upwards of 95,000. And you can see here, if you look at the upper end, skilled nursing facility can make upwards of over 100,000. Not to say you can't also make 100,000 in other settings, but just good to be aware of kind of averages for that. Let's briefly compare this with educational SLPs, just so you're aware of different types of settings. And what we can see, very similar. You separate here by types of schools: preschools, elementary, secondary, and then combined. We're just going to attend to this average here. And what you can see on average, educational SLPs tend to get paid less overall than medical SLPs. However, there's differences, right? Often we think of educational SLPs having about a 9-month contract with summers off, although that is progressively becoming less and less time off for those of you who are aware of educational issues. So appreciating that although you'll see a lower income, there are differences in the amount of time that we are working over the course of a year. And so that could account partially for the amount of income here too. Okay, hopefully that's helpful. I always find it, I always had those questions as a undergraduate at the time, so it's good to be aware of those issues. Oh, sorry, I'm not sure. Why is it doing this? Okay.
Okay, so at this point, I am going to just share some information with you that we researched on the topic of medical speech language pathology back in 2018. So at this point, we have developed a medical speech language pathology concentration in our speech and hearing sciences department at PSU. That has been in the works for several years. And one of the preliminary things that we did in preparing for this was that we put out a national survey with the help of a student team at PSU to get a better sense of what are the expected proficiencies, the essential training, and the knowledge base required when you apply as a speech for a speech pathology clinical fellowship position. And I realize we have a lot of individuals here who are currently undergraduate or post-bac. And so I just want to begin by explaining that after the process is that after you complete the master's program in speech language pathology, in order to become certified as a speech language pathologist, then you complete a clinical fellowship, which is typically approximately about a year. And so after completing the master's program, if you intend to work in a medical setting, then you would be applying for a clinical fellowship in a medical setting. So what we did is we surveyed the nationally clinical fellowship supervisors in medical settings. So we put together a Qualtrics survey. We had an anonymous link for access, and we posted it in the ASHA special interest groups. We posted it at OHSU as well. And for participants, we requested speech language pathologists with at least 5 years of experience working in adult medical settings and or who have held supervisory roles. And so we basically surveyed them on a lot of information, demographic information, and then open-ended short answer responses and Likert rating scales. I'm actually not going to present all of that because it would take far too long, but I'm going to share with you some of our conclusions from that survey. So some of the results to our open-ended questions indicated some themes with respect to skills that were felt to be lacking in newly hired speech language pathology clinical fellows. And the reason we were interested in this is because at PSU, in developing our medical speech language pathology concentration, one of our goals is to set our students up for success, to help our students to be competitive in successfully applying and getting good clinical fellowship positions. So across the nation, dysphagia training and knowledge was the #1 thing that supervisors felt students needed more knowledge in. The other was navigation of medical settings and terminology. And third, but certainly not least, this came up quite a lot, critical thinking skills, ability to think on your feet with your basic knowledge, such as basic anatomy, physiology, what do you know about language processing, what do you know about swallowing physiology, and problem solve in patient scenarios with that information. And so then we also asked if you could recommend an area of increased focus for speech language pathology graduate programs, what would it be? Again, dysphagia came up. And again, critical thinking and problem solving. And again, navigation and familiarity with medical settings and terminology. So we've, in building the medical speech language pathology concentration, we have been very cognizant of these needs in the community. So another question that we asked was, do you have recommendations for specific training that would aid competency for newly graduated students entering a clinical fellowship year? So again, dysphagia came up, skilled dysphagia training, specific medical SLP training, which is exactly what we are working to do, diverse and intensive clinical practicums and placements. What additional advice do you have for newly graduated students regarding preparedness? So the advice from clinical fellowship supervisors across the nation: ask questions and seek clinical guidance. And don't underestimate your knowledge and abilities as a clinical fellow. Be motivated to seek continuing education and medical SLP training opportunities. I have had a student at one point ask me, at what point do you know everything there is to know in the field? And my answer was never. You never know everything, so you really need to be prepared. You have your, we will, you know, in our program, we provide foundational information, but you need to be prepared to be a lifelong learner and learn how to learn how to look things up as you need to know more. So that is ongoing. I had another student ask me, at what point have you quote unquote made it? Again, never. There's always more to learn and more to do. All right, so in conclusion, with this particular survey, the themes gathered regarding the traits, areas of expertise for speech language pathology clinical fellows suggest the need for further improvement and evolvement of speech language pathology graduate training that can accommodate the clinical demands in medical settings and work with associated medical specialties. So the results of the survey revealed these themes regarding increased focus, training, and expected characteristics. So we have listed here evaluation and intervention strategies related to swallowing, including the modified barium swallow study, which is, for those of you that don't know, that's our gold standard imaging for swallowing. It's like a video x-ray of swallowing. Language, cognitive communication, and motor speech assessments, familiarity with medical settings and terminology, diversity and intensity of clinical practicums, interdisciplinary collaboration, thinking about all of those disciplines that Cassie reviewed, critical thinking and problem-solving skills, and receptiveness to feedback. So these are the skills that we are targeting in the medical speech-language pathology concentration to prepare newly graduated students to be independent and proficient clinical fellows, and most importantly, to serve patients well. You know, if we think patients first, we want patients to be served well.
Okay, so as Dr. Britton mentioned, we did create a medical speech language pathology concentration here at PSU. We are in our inaugural year this year. We have our first cohort of students, and we're super excited about that. So let's talk a little bit about what that looks like and what the requirements to apply are, since most of you on this call are likely undergrad postbacs and preparing to apply or will be applying for grad school soon. It'll be important for you to understand maybe some goals and focuses you need to look at before you apply to the concentration. So first and foremost, the mission of our concentration, the PSU SPHR Medical Speech Language Pathology concentration offers an additional rigorous advanced specialty training for graduate students interested in a career as a medical SLP. So this is for folks who know that they want to become a medical speech language pathologist. I was one of those people, which is what has driven my passion for this concentration. I wanted as much exposure and experience to the medical side of speech language pathology before entering into my clinical fellowship. And so that's where this sort of is born out of. This program will provide graduates with a competitive edge in seeking positions for SLP job opportunities in multidisciplinary medical settings across the continuum of care with both adult and pediatric populations. And clinical training opportunities will include assessment and treatment of dysphagia, motor speech, voice, craniofacial, language processing disorders, and cognitive communication with a variety of acquired, developmental, and neurodegenerative adult and pediatric populations. Clinical training will include tracheostomy, mechanical ventilation, and augmentative and alternative communication. As we've already sort of mentioned in our bios, we have a wide variety of expertise within our clinical faculty that cover these areas, which is what allows us to provide you with that training. So what do you need to do? So these are things that you need to do prior to beginning the program. So prior to beginning grad school, and to be able to complete that application for the concentration. First and foremost, you have to be accepted into our PSU Speech and Hearing Sciences Master's Degree Program. You need to submit an application for the graduate medical SLP concentration. And you need to have academic coursework relevant to neurological communication disorders and anatomy, physiology of speech and swallowing mechanisms. And this is to be approved by appropriate faculty. Ideally completed prior to entrance, but could be completed simultaneously with the master's program. Although we find anything that requires being needed to be completed in conjunction or simultaneously with the master's program is definitely a challenge. The master's program is pretty rigorous, and anything additional is quite a lot to take on. So the more that you can get done before you enter grad school, the better. And then experience hours. And this is where we tend to get the most questions. So I'm going to try to make this clearer than mud for you all today. But essentially, we want you to have this additional 45 hours of experience. And this can include volunteer or other work experiences in medical settings in a capacity related to rehabilitation or working with individuals with disabilities. So we have, you may see the emails we send out where we have opportunities to be a buddy for the TBI program we have in the community, or opportunities to be a volunteer within a rehab setting at a hospital. Or maybe you have connections and you shadow a speech language pathologist within their setting. So these are things that expose you to not just medical SLPs or practice, but people within the medical community that have disorders. So like the buddy program, you're not doing any treatment or assessment, and you're not even working with an SLP, but what you are doing is learning about what it looks like to live with a neurological disorder. And that is really important, and it definitely counts. And then you'll notice it says and/or the shadowing of healthcare providers. So it could include both of these things: volunteer work, shadowing. You can shadow interdisciplinary, so occupational, physical therapists, respiratory therapists, physicians, as long as you're again being exposed to people with diagnosis and disorders that relate to the medical field. And then the last bullet says and this is really important. And I know that looking through the names of people on here, I've had a lot of you in guided observation. So hello again. This is that required 25 hours of observation that ASHA actually requires of you. And that you, again, could complete simultaneously once you're in grad school, but ultimately it's ideal if you have these 25 hours done before you come into the program, which is why we've made guided observation a required course and a structured course to help you obtain these guided observation hours. So as we know, there's 25 required hours by ASHA. And what we're saying here is that a minimum of 15 of those hours need to be assessment and or treatment across at least 3 distinct settings and or medical populations. So you might do some guided observation, whether that's live or through master clinician or through guided observation of pediatric and or adult, and across any of the populations that we list here. We have a pretty broad description of what counts as medical treatment and assessment. But if you have any questions about that, you're welcome to reach out to us and ask. So you need those 25 hours. So additionally, what that means is that there needs to be an additional 20 hours within the, apologies, I'm stating that wrong. See, clear as mud. Maybe y'all can correct me. We just had this conversation. So 25 hours in addition to the 45 hours. Committee, yes? Yes, thank you. Okay, so you need 45 hours within the volunteer and or shadowing category, and then you need to have your 25 hours of observation completed. Okay, so what is that, 70? It's early, so math is hard. 70 hours. Okay. And then there's a little note at the bottom. I don't know if you all can see it. It's kind of small on my screen. Because of the pandemic, we realized that these volunteer and shadowing opportunities are harder than ever to make happen. And so we definitely are being cognizant of that. And what we're saying is just apply, and we will take a look at applications and make a determination as a committee, regardless of the amount of hours that you have. Obviously, the observation hours should be completed, but for the shadowing and the volunteer experiences, we will definitely take that into consideration. So if you don't have those hours, don't think, oh, well, I'm just not going to apply because I'm not going to get in. Please apply and allow us to review your application and make some decisions. Is this me still? Cool. All right. So application process. Again, this is our inaugural year, and we are learning a lot through this process. And so what we know as of for this coming year is this has to sort of coincide with the application process for grad school, because you need to be accepted first. So generally, don't quote me on this, but we send out acceptances to the program sometime in February. Once those go out, the committee will then send an invitation to apply to the medical concentration. And then we will provide you within that invitation email the application as well as due dates to be completed. However, the due dates will likely be sometime the first part of April, because students have to have their decisions back to the programs by April 15th. And we want you to be able to utilize your acceptance to the program as a decision maker, your acceptance to the concentration as a way to decide if you want to be in our program. So we'll have those back to you before you need to make decisions about what program you go to. And then we go from there. There is a link here that takes you to a website that will give you all of this information that we are talking about. And it's also where you can find the application once we get ready to send that out, but we will send it in an email as well. Me still? Okay.
Yeah,
Sorry.
I just want to chime in. I'm noticing M's message that we have just a few minutes left for this presentation. So we're actually running short with our content. And my thought is maybe we can touch on the remaining items quickly.
Yep.
It's basically reiterating information that is also on the website.
Yes, we definitely can. So, yes, the next couple of things we talk about is the coursework that you will take within the program, the clinics, and the externships. Again, you'll have access to these slides, and this information is on the website. And this isn't, this just gives you information as to what experiences you could potentially have within this concentration, but will become more more important as you get accepted into the program and into the concentration. So please feel free to refer to the website for that information. Reach out with questions if you have them, and let's go into Q&A.
Okay, any questions? Feel free to offer questions in the chat and or chime in with questions.
We had one question from Lily. She was asking if you guys always knew that you wanted to go into medical SLP and what drew you guys to becoming a medical speech language pathologist.
Yeah, I can start with that. I was very clear about wanting to be in the medical field, medical speech language pathology. Part of what drove my decision is because I was actually a pediatric patient. I had a medical condition, was in and out of hospitals with a trauma injury as a child. And then later on, I became a hospital volunteer. And then I became a speech language pathology assistant in a medical setting. So for me, it was clear. However, I realized it's not clear for everybody. Many people do need, many of our students do need time to explore what they want to do.
I'd also say for me, I knew since probably high school that I wanted to be in a medical setting of some sort. It was during high school that I discovered speech pathology. Since that time, I had never really looked back to being an educational SLP. In fact, everything I had learned just kind of reinforced my decision about medical SLP. But again, I appreciate, there's a variety of reasons that people choose educational speech pathology, and I think it's a great career for a lot of individuals.
I'll keep my answer really short. I just knew educational was not a place for me, and I did a year as an assistant SLP in this educational system, and it just solidified for me that I will never work in a school. And if you want to hear more about that later, hey, contact me. But definitely knew I wanted to be in the medical setting. Teal asked, and I answered in the comments, but can you focus on both peds and adults within the program, or do you have to choose? And yes, we certainly have students right now that want experiences across ped and adults so that they can determine really where their passion lies. So we definitely do both.
I would also add that we have the transitions population. So there are many people who are in the pediatric medical system lifelong, but then as soon as they age out of the pediatric medical system, they are then suddenly thrust into the adult medical system. So we work with those folks as well.
We had another question from Rachel asking if you can please talk about what work with craniofacial pediatrics looks like.
Yeah, I could probably do that. I'll try to keep it brief. And if you'd like to connect after Rachel, I'd be happy to talk to you. Essentially, I mean, it's a very interdisciplinary focused practice. Almost all clients with history of cleft or craniofacial conditions or differences are associated with a cleft team. So Shriners Hospital has a cleft team, OHSU has a cleft team, Legacy has a cleft, Kaiser has a cleft team. So certainly most kids within our state are at least connected with some sort of cleft team. That's usually seeing a plastic surgeon, craniofacial surgeon, ear, nose, and throat doctor, speech language pathology, nursing, and many other professionals. So it's a great way to get all of their needs met through one place. Now, SLPs in the community might still be providing therapy to those individuals for speech sound disorders or language disorders. But again, almost all clients are served by some interdisciplinary team, often associated with a hospital with that too. So again, I'm happy to connect after and probably talk more about that if you'd like to.
And there's a question here. Have any of you worked with persons who have had facial burns or burn victims? And so, if so, in what settings? And is there advanced training that we would need to work with these folks? And I can say that, yes, I have. When I worked at Harborview Medical Center in Seattle, we had a burn unit. And in that facility, speech language pathologists received additional training in order to work with burn victims. So there are additional competencies and trainings to work with burn victims, but that's true of a lot of specific populations. Depending on where you work, it is important to take time to get to know the population that you're working with, the characteristics of the medical condition, and then you become an expert in that area. And working with burn victims is one example of that. And I'm happy to talk to you more about that.
And then we have a question from Marielle.
Hi, yeah. So my question was regarding the guided observation hours. So I graduated over the summer and applying this term. But what I'm wondering is, I know that I met the requirements. Cassie, I took guided observation with you, but my concern is I might not hit the required specific amount of hours. And if so, would I still, if I'm not an enrolled student, would I have access to maybe some additional observations I could be a part of to make sure that I'm hitting the required amounts in a specific direction?
I would say that if you took my guided observation course, you've met the requirements.
Okay, great. Just want to double check. Thank you. And thank you all so much for this wonderful presentation. Thank you.
And then it looks like Teal had a question about what SLPs do in the NICU.
Yeah, Teal, I'd be happy to connect after too. Actually, I just worked with a master's student who completed a project about NICU practice for SLPs. And so I could certainly share that presentation she put together that's recorded too, that I think will share a lot of information. And if we have a resource list, I'm sure we can share that with everybody as well. But yeah, I'd say a lot of what was reviewed in that tends to be around supported feeding experiences, especially for new families, especially when there's complex feeding situations going on. That tends to often be the focus, and early language experiences.
Okay, are there any other questions we haven't yet gotten to? There's one here. As a first-year student, I did not have my observation hours completed yet. There are online platforms to secure more hours. Thank you for that comment. Any other questions before we wrap up for today? And I just want to add, I'm confident that other questions will arise, and we encourage you to reach out. As we get more questions, we will also have the task of improving the FAQs on our website to make the information more and more clear as we move along. We have, yeah.
Oh, I was just going to say a quick last call for any questions. Otherwise, Dr. Britton, if you had something else to say, go for it.
I think that's it. I think we'll wrap up for today. I want to thank all of you for participating with this conversation. We are grateful and we really appreciate your interest in this topic. And we strongly encourage you to liberally reach out to us if you have any questions regarding the medical speech language pathology concentration and/or preparation for work in medical settings. We are here for you.
Thank you so much for your time at this event. Thank you, thank you, students, for coming and observing. And if anyone has any other questions, please obviously reach out to our panelists and come to future events. I believe we've got a Phonetics Friday coming up on Friday of this week. And yeah, thank you so much for being here, giving us your morning. Everyone have a great day.
You too. Thank you. Happy holidays, everyone.
Bye. Thanks, everybody. Have a great day.
So I'm gonna send the photos, screenshots to, do I send it